Well, good evening, everyone. I'm Carlos Clanton. I'm the Ward 3 member of the Norfolk City School Board, and I'm joined with my colleague,
Dr. Noelle Gabriel, the Super Ward 6 School Board Representative.
Glad to have you. And we want to welcome you all for this conversation. We want to give you an update from our perspective as school board members. And in regards to, we had a meeting last night. We're not going to be recapping a meeting. It was a very long meeting. We're not going to recap that. But we definitely want to talk about the action and to fill in any of the blanks. So the questions that you all may have as parents, as guardians, individuals in the community. So this is a conversation and information session. So how do you become a part of the conversation? If you are watching us on Facebook, if you're on Periscope, if you're even on my YouTube channel, in the comment section, you can actually put your questions. We'll see them. Like we have Alexandra Nazar, she's here. I'm going to put her up there. She's saying hello. We've got Bobby Taser saying hey. And Bridget Schultz is also saying hi there. So place them there. We'll be able to get those questions. And so as we go through, we'll have certain points where we'll stop. We'll definitely ask questions, but we want to kind of fill in the blanks for you. We know that this is a very trying time for everyone. It's very stressful. And I'm glad to have Dr. Gabriel, because I'm not a doctor. I'm just a very passionate school board member. And to have her here to kind of give some of lend her expertise on a medical experience there. So where do you want to start? You want to just hop right in there?
Yeah, let's just hop right in.
All right, so I'm going to bring up, give me 1 second here. I'm going to bring up some slides here that we've actually taken from the information that we had in regards to last night. And so I'm going to bring that up now. There we go. So the Norfolk City School Board voted to return students to in-person instruction. And I highlighted this because I think that the press release was a little misleading because it didn't say only when health indicators set forth by the Centers of Disease Control, CDC, fall in the lower or lowest risk transmission of COVID-19. These core and secondary indicators, which can be found on the CDC's website, are labeled in a dark green and light green. And so, Dr. Gabriel, I know that you presented this and you made a motion for us to go in this direction. So you want to kind of give a little bit more background on that?
Sure. There's been a lot of thought that has gone into why I thought that it would be best for the city of Norfolk to adopt these specific measures particularly. The CDC, I have a lot of respect for. And I also have thoroughly reviewed the Virginia Department of Health guidelines for return to school indicators as well. And they're very similar. For Norfolk, we had a presentation by Dr. Demetria Lindsay. She is the leader of our health department, both for the city of Norfolk and for Virginia Beach. It was very clear by her presentation. And from the data that is present on the Virginia Department of Health website and updated daily, that the demographics within the city of Norfolk are very different from the demographics of our neighboring cities. We have a higher percentage of students in Norfolk Public Schools that are students of color. And the city demographics are also one that is also students of color and higher risk of mortality should they contract the virus. And so looking at the risk burden, the decision for me at least was, what risk am I willing to take to put forth a set of guideline measures to allow staff, and remember, we have 5,000 staff members with Norfolk Public Schools. That's teachers, custodians, administrative staff. And then our student population, we have, probably, about 28,000 students that would potentially be affected by this. And so I thought that if you look at the two light green and the dark green categories there, those pose the least amount of risk to our staff, to our students, if we begin the phase in instruction for the in-person learning to take place. This has nothing to do with childcare programs that are already taking place right now. It has everything to do with hitting the start button for in-person learning. And this is another item to consider. Teachers and our custodial staff and other persons who are working in the school building are in a different situation than, let's say, the nice gentleman who's checking you out at your grocery store. Teachers would be in sustained contact with the same individuals for a lengthy amount of time during the day. And so that automatically increases their risk of transmission should a student be in the classroom that is positive for COVID. And then you can reverse that. If a teacher is positive, that teacher is interacting with that class for, 4 or 5, maybe even 6 hours a day. And so we have to take that into consideration as well. So what you see here and why I proposed the motion was 2 categories: the lowest risk of transition. And I believe that that is the safest for Norfolk Public Schools. And I'm glad that it was adopted.
So, Dr. Gabriel, when we're looking at this here, and I know that folks are seeing the screen, so the dark green and the lighter green. So the dark green is the lowest, the lighter green is lower. We're starting, so as long as we are from that lower, the lighter green to the darker green, that's where we want to be. And so each one of those categories, if you count, it says the number of new cases per 100,000 persons within the last 14 days.
Mm-hmm.
So can you kind of explain or elaborate on that a little bit for individuals that they're trying to understand what the medical science jargon is?
Right. So the number of new cases would be like true confirmed cases for individuals within 100,000 persons tested. So if there are if you look at the lighter green category, if there are between 5 to less than 20, then that puts us in that risk category for a risk of transmission in school. And what that's doing is it's basically saying how many individuals are out there with positive cases that could have spread the disease to other individuals. Mm-hmm. If you go down to the next level where it says percentage of RT-PCR tests that are positive during the last 14 days, that's testing that has come back positive. And testing it's important for everyone to understand there is not one test that is being done in order to test for a positive or negative test. There are a couple of tests that are out there, and a test is only as good, truthfully, as the individual who is administering the test. Mm-hmm. So if a physician or if you're getting the test done at CVS or wherever, if they're not properly inserting the swab, then you may get a false negative. And mm-hmm. At baseline, the tests that we have, which their positivity rate is based on individuals who have symptoms, okay, those tests are only 70% accurate. And mm-hmm. So there's a window of 30% of individuals that we possibly could be missing. And I don't say that to, for fear to say that we're missing all of these tests. It just is what it is. And I think that every day we're trying to get closer to more accurate testing that's more specific and more sensitive. But we're just not there yet. And so, for example, if a child comes into the office, their pediatrician's mm-hmm. office, they could be potentially offered 2 different tests. One that takes about 4 to 5 days to come back, and one that takes 2 days to come back. And so there's a variety of times when the parent could get the results, and then you have to go back to the contact tracing mm-hmm. after that. Another critical factor that was just discussed in the recent American Academy of Pediatrics, the national meeting, was the availability for rapid tests. So mm-hmm. we've heard, like in Congress and for the president, there's these tests that come back in like 15 minutes. We don't have that yet. I know that that's a goal, but if we're truly serious about decreasing infection rate, then it would be very beneficial for us, especially in a school setting, to be able to administer a test and know within 15, 20 minutes with some degree of validity that somebody is either positive or negative.
Mm-hmm. So
It's
I'm
really,
gonna,
it's really important.
yeah, I mean, trying to figure out, I'm getting an echo. I hear that there are some additional questions that are here, and I'm
Okay.
going to definitely make sure we address those in there, because some of them are going to talk a little bit later about the number of days when we talk about virtual and hybrid. And so when we get to that particular portion there, I'm going to make sure that we definitely address those. I want to talk about the secondary indicators and address those as well. I'm going to bring that up. Okay. So we've got the secondary indicators, and this was kind of important too, because this we have the primary or the core primary, and then we have these secondary indicators. And so what are these secondary indicators?
So the secondary indicators look at items that are outside of individuals who are testing, who are determined as positive, tests that are coming back as positive. And this basically dives deep into, whether our community is going to be able to handle an influx of COVID patients. And this is very important because, as I said before, there's that 30% window where, tests may not be positive if a patient is positive. But if your ICU beds are being taken up by, a respiratory illness, and you haven't identified exactly what that virus is, then that could be an early warning sign to say, hey, your degree of disease burden is high, and your community resources may not be able to handle that. This is what is taking place right now in Wisconsin. In Wisconsin, their hospital beds, their ICU beds are right at the level of about 85% capacity. They're starting to open up, field hospitals to take care of less critically ill patients. And right now what they're doing is they're rationing out healthcare resources. And so, do we want to be on the back end of things and wait until our hospitals are stressed? I don't think so. I think that we have to live by the mantra, an ounce of prevention is worth a pound of cure. And we need to, for everyone's sake, we need to look at the secondary indicators as not the most important warning system, but as a measure that can help to identify early warning signs.
Definitely. And I seconded the motion that you put forth here, because I strongly believe in placing health and safety at the foremost. And I mentioned it last night, that it's been said, a child can't learn if they're hungry. Well, a child can't learn if they're sick. A teacher can't teach if they're sick. Our staff members can't do the things that they need to do if they're sick. But most importantly, and it kind of felt that sometimes we got this balancing thing between the educational quality, but then also the safety. And it's, you and I both were debaters in high school and in college, and that's how far we go back. But it's a lot, we learn a whole lot about these different theories and so forth. And, and it's one of these things you gotta have. I believe that you gotta place health and safety at the forefront. And this is what I had been really focusing on, our quality and what we can provide inside buildings. But then also we talked about these critical communities, particularly in the African-American and those of color, who are already at disadvantages in so many different things. And then you place in a pandemic, it really exacerbates a lot of those things and it magnifies it. And so we haven't even talked about our staff members who may have underlying conditions. And so, I know some people talk about the respect, but we'll never get in the green. And this is where, honestly, I have to say that I agreed with our chairwoman, who stated that, honestly, this is a community thing. And when you talk about the secondary indicators, this is community. This is the entire community coming together to ensure that we need to wear a mask, social distance, make sure we're cleaning washing our hands, making sure that, as we're going into these holiday seasons, that we're doing what we need to do so that we can get back into school. And we can get our students back into school. Other communities who may be doing those things are doing the mitigation that needs to happen to ensure that you have the least risk. And for me personally, as a board member, I just can't see using our kids or staff members as guinea pigs as we're still trying to figure this out. So if we've identified where the lowest risk is, that's what I'm supporting. And that's what I did support last night.
Yeah, and I appreciate you for supporting that. And I think the answer comes down to, what level of risk are we willing to take as the leaders? Because
Mhm.
these are the decisions that we have been elected to make, whether
Yeah.
whether we anticipated this or not. And in my profession, I live with making these types of critical decisions, not on a scale as to this magnitude. And I truly feel that this decision was probably one of the most important decisions that we have come together as a board to make. But I'm very accustomed to dealing with risk, to talking with parents about things that they need to weigh in order to make a decision about their child's welfare. There is nothing more precious to a parent than their child, and I take that responsibility very, very, very seriously. And
Mhm.
whether I'm counseling a parent on obtaining a vaccination or counseling a parent on performing an invasive procedure such as a lumbar puncture, I understand what they are thinking of in the back of their mind. And for some individuals, until it hits them in the face and
Yeah.
they see sickness and they see a child that's intubated or they see their parent on a ventilator, it doesn't hit them that it could be reality. But this could be our reality if we
Mhm.
choose to go in a direction, which thankfully we did not, of tolerating something of moderate risk, of higher risk.
Yeah. And I know that this kind of capsulates into this other one here. When we kind of talked about the phase-in approach, and so we're going to come back to phase-in approach. I want to go ahead and tackle a couple questions that are in
That sounds
here.
great.
So I've got, let's see, we've got quite a few who's in here, and Erin Sweeney is on a lot. So we'll definitely make sure we get a couple of questions that she has in there. So we have let's see if I can bring this up here. All right, so Angela Baldwin says, I'm concerned about the number of the students going for 4 days of teaching-led instruction to 2 days of teacher-led instruction. I plan on keeping my kid virtual. Is there a way to keep the 4 days of teacher-led instruction for virtual students? You want to take a stab at that one, or you want me to jump in there on that one? Because I think we agree on.
Yeah, yeah, and this is a great question. And as board members, we are inundated. We have immersed ourselves in trying to understand what all of this means. And so, for those who are tuning into our meetings, it may be very confusing initially, but let's break it down. So, right now we are 100% virtual. Okay. The proposed plan that was voted on last night, what that means is that when the CDC metrics allow, which are then the green categories that we just discussed, when that time is appropriate, then students can come back into what we call the hybrid plan of instruction. It is my understanding, and Carlos, you can jump in as well, that what Dr. Birdsong's intentions are to have 2 days a week. But, well, let's take a step back. There are two houses. Okay,
Yeah.
there's a house A and there's a house B. House A would go in on a Monday and a Tuesday and have live teacher instruction, face-to-face instruction. Okay.
Yeah.
Simultaneously at that time, that house B would be online and seeing that live instruction virtually.
Mm-hmm.
Wednesday would be an asynchronous day, meaning that it would be just student independent learning, no teachers involved as far as live instruction or virtual instruction. On Thursday and Friday, the houses flip, and the B house goes for in-person, face-to-face instruction, and the A house then is joining in virtually. So 4 days, they are getting instruction, new content, teacher led, but only 2 out of the 4 days are actually in person with the teacher. That's how that is broken down.
And we're using cameras, and that was what you may see in the presentation. And there are these Logitech cameras that will allow the teacher to teach, have students online, and then students in person. Now, I do believe that you and I both agree, and that's one of the last sentences that you'll see there that came out in the press release, and as well as that was online. It said that the school board asked the superintendent to continue to explore the best learning models for in-person instruction, including a non-hybrid model. I have been in contact with teachers and instructors around the country, and I'll tell you, some are doing this, and they have talked about the stress level. It's hard enough to try to make sure that the students are being focused in a classroom in person, but now you have to make sure they're focused. You have to make sure the students who are online are focused, being able to answer their questions. But then also we've layered on these health mitigation things, make sure their masks are on, make sure there's social distancing. So there's a lot of additional pressure. And I think that, and I was very much touched by our two student representatives last night who spoke, and who both said they're in high school, but both of the young ladies mentioned directly to us that, they drastically see the quality of education, their experience being hampered when they have to go in person because of all the things that they have to do. It's not like being in school versus really being focused on virtual and doing the best we can there and in that model and making it the very best. And I found that was interesting because while we have all these others that are saying in person, here it is, we had two students who were sitting here to be the voice of the student body who were saying, no, actually, we would like to do what's best and maybe possibly just stay with the virtual because we don't see that the quality that we're going to have is going to be really good in person. So I found that to be very eye-opening. I don't know about you, Dr.
I thought that their comments were very appropriate and gave us a good sense of what they were thinking as far as their perspective for in-person learning. And they're right. When the children do eventually go back to school, it is not going to be the way that they remembered it. Their desks are 6 feet apart. They're not socializing in the cafeteria. They're not going to be able to do the things that they were doing. And that's going to be difficult for them. And can children adjust and overcome? Absolutely. That's one of the great things about children. They're very, very resilient. But to go back to the, toggling between in-person and virtual simultaneously while trying to mitigate, health factors, I think that's a very heavy burden to place on our teachers who are already worried right now.
Yeah. Alexandria said, thanks for bringing up the differences in Virginia Beach and Norfolk. I think I did that last night. Norfolk, and when you look at Virginia Beach and Chesapeake are suburban school districts. I mean, Norfolk is an urban school district. You start looking at our populations, student population mirror closer to Portsmouth and Hampton and Newport News than in Virginia Beach and Chesapeake. And when Dr. Lindsay came in, there's two slides that still stick out to me that she was talking about the additional considerations that we needed to take in effect, not just the science and the numbers but then also looking at the individuals who are going to be placed into these situations and the different challenges that they may have. So I just wanted to share that one in there. I've got a Liz Burns says that yes, look at the national numbers of increased cases, increased hospital crowdings. Are the parents going care for teachers and staff to get ill by going back to the classroom? Well, I think we're trying to avoid that. And I know that I want to get one in here with Erin Sweeney. There's so much I'm trying to get back up here. And so I don't want to, Ms. Sweeney said that we've never, have we never been in an all green in all 5 categories? And she's saying that this may be very misleading. But I don't know if we've ever been in all 3 other than before we even started in this situation. But I think that it's the aspirational goal that we're saying that we want to work towards, and that we can't do this alone, even just as the school board or school administration, but this really becomes a call to the community that we have to do what's in the best interest if you want our students to return back and be safe with the least amount of risk. Would you agree?
I agree.
Yeah. And we have had categories where we've had green and we've had some yellow. Matter of fact, I think on the day of our board meeting, we actually had some that might have been in the orange, right?
Yes, we did.
Yeah,
Yesterday, there was one of the secondary indicators was orange.
yeah. So I guess we kind of talked about this in this respect, and I know that the board has to come back to it. But we talked about the 14-day, and I'm gonna bring that back up here. I'm gonna take Aaron off here. Just take that off. It'll seem like it's a little slow there. I want to bring this back in here to talk about the 14 consecutive days, and we talked about this phased-in approach. This is what took a lot of time, and I know that I've heard a mixture of people, who have praised, the meeting. Some others who took too long. But to be perfectly honest, this is where you say it all the time, Dr. Gabriel. This is when you're watching sausage making.
Yes.
We are a public body. So where in many situations, a lot of us might be able to get together. I would love to have more of my colleagues on my live show, but I can't, because when I have a third board member, then we have an official meeting and we have to give 3-day notice and all these other things. We are getting, and you may have heard it, we got a lot of different information, but it was really the first time as a board we were talking about it and hearing about the different perspectives that people had. And so we came out at least saying that we would go with the 14 consecutive days because that's what the CDC recommended. Mm-hmm. We would utilize that once we had those consecutive days to determine whether or not we would phase in. One of the things I kept really stressing about was that I didn't want a November 4th day. Because I didn't want to, because I didn't feel like we had enough time for the 14 days to even allow that to happen. And I know I proposed a motion to just set a date because, it was mentioned, why don't we just put a date out there off and we just stay virtual? And so I proposed a February 4th, which would have been the end of the second quarter, as a time for us to get there. That didn't pass. And so we got back to this, which kind of forced us to really talk about a phase-in approach. If you get the 14 consecutive days, we were all green, then we will begin this phase-in. And so you want to kind of address what that phase-in looks like?
Right. So from the very beginning, our board was 100% committed to making sure that our students with the greatest need educationally and who would have the greatest risks for falling behind educationally, that we got those children back in as early as possible, or we at least made them the priority. And that's what you see here. You see our students of the administration calls them our equity and opportunity students. So students with disabilities that are in the self-contained classrooms and our English learners. They're the ones who, virtual learning is it's there, but the in-person instruction is really where, they're going to get the highest bang for the buck. So that's our phase one. And to the administration's credit, they listened to the board and they tried to make things work so that these students could at least get the in-person instruction 4 days per week. And I believe that's what they're going to aspire to. I know that Dr. Birdsong needed a little bit more time for the English learning population to see if that could be attainable. And then you have your phase two, which I thought, again, I have to, commend our colleagues for having, a good discussion. That these were not easy discussions, but then to adopt, kindergarten through grade 3. Originally, the plan was to leave the pre-K students in under phase 1, and we, discussed why there was concern about having the pre-K students in at that time. Phase 3 is grades 4 and 5. And then you see in parentheses hybrid model. So when they do go into school, they will be in the hybrid model that we just outlined. And then at phase 3, we would also talk about the return of pre-kindergarten students to come back. Remember, Norfolk Public Schools has so many more pre-K classes, pre-K 3 and pre-K 4 than the other school divisions. And that's needed because our students have that need. And so we understand getting them in and why that is important. But at the same time, they're also of a population that may not be able to keep a mask on and keep socially distanced and, follow instructions as we imagine it to be. And then you have phase 4 and phase 5.
Yeah, 4 and 5, which are middle in our high school
Mhm.
students, and it's all in a hybrid model. But we definitely given a directive to the superintendent to look for other ways of beyond a hybrid model. I want to bring in another question. I think this is a good one. Bridget Schultz is asking. Will there be plexiglass dividers or anything like that in classrooms, or just trying to distance by 6 feet? And I do understand that we are getting some of those plexiglasses, and some of those things have been ordered. I know definitely for the offices and for some of the classrooms. I don't know whether or not all of them have been ordered and placed in the classrooms. And so that's something I will definitely make a note to myself, Ms. Schultz, to find out and give an update later. I don't know if you know. I know
Yeah,
you're. Yeah.
I'm not sure about the plexiglass
Mhm.
for the individual students. I definitely know that the office and the nurses station, well, let me just say the offices. And I
Mhm.
think that they are trying to do it in other areas where there's contact with individuals in a, like a parent coming into the office or a student in the nurse's office. But to be perfectly honest with you, I would not put a lot of faith in glass dividers in a classroom. If a kid coughs and is not wearing the mask, the
Yeah.
plexiglass is not going to catch the particulates that get airborne
So,
in the room. It's
and
just
and
not.
that's a good point, because I think even while we were in the meeting last night, the CDC actually put out some new guidance that was talking about where it was thought that 15 minutes of continuous exposure was, I guess, the standard that we were using. And now it's like 5 minutes, and it could be 5 minutes over like a 24-hour period of time, kind of moving around. I mean, this is a novel virus, meaning that we're finding out something every day. We don't know what we don't know. And honestly, it keeps evolving. And I think that you shared something with me earlier today. I don't know if you want to talk about, a lot of people talk about, well, if you get COVID-19, then you build up the antibodies and you can't get it again.
Right, right. And there are two cases in Virginia right now that individuals who have previously had the infection are now infected with a different strand of the virus. And so essentially what that's confirming is that you can get the virus more than once, that your antibodies may wane, and that the virus is mutating. And I think that, that is that's developing right now, that story. But they're looking at two individuals right now. And so we cannot take for granted the fact that this is a novel virus, and we are learning things about the virus every single day, how it affects the body.
Mhm.
Um, 10 years from now, we're going to learn about how individuals who have been infected with COVID have, lingering effects, possible lingering effects. So this is just something that we're just going to, as a society, we're going to have to be ready for.
Yeah. So Ms. McNabb says, what is the point of a phased-in hybrid schedule if we're waiting for green metrics? Is the risk is that low? We should be able to send all the students back. And I think that actually came up in our discussion. The reason why we don't want to send all the students back until we. You want to elaborate on that one?
Well, I think that last night, what the board was very determined to do was to give an answer to the public, the families, and to the staff of some sense of direction. And I think that was important. And so
Mhm.
we had to come together on what a plan would be. Um, I'm looking at her question right now. What is the point of a phase in hybrid schedule if we're waiting for green? That's basically just saying that, once we are in an area of lowest and lower risk, we are willing to phase in students for, some type of in-person education. The
Mhm.
reason that the hybrid model is the model that we have before us is solely based on the resources that our school division has. The
Yeah.
superintendent has outlined that over and over and over again, and we have to trust her. I think that it would be um, it would not be good practice for us as a board to ask something of the superintendent, knowing that she may not be able to deliver on that, if we were to do that. For example, if we were to demand, 4-day-a-week in-person instruction, I think that greatly decreases the ability to have quality instruction, to mitigate risks, and to keep our students and staff members safe.
Definitely. I've got and I just want to also, because I think I cut myself off sooner when I said we don't want to send all the students back. We don't want to send all the students back at the same time.
Right.
We want to phase in things. And this is where it's important when we talk about the 3 weeks. We've got phases. So when you have that phase 1 go in, and I think we kind of had a brief conversation about this. It's like, well, what happens when we have that 2 weeks of either declining or stabilized numbers and they're within the green category, and then all of a sudden we have a jump, once we've released students in. And I think that that's a question that the board has to really go back and to say, well, are we just looking at the 2 weeks? And so even if there's some jumping in there in between that 2-week period of time where it keeps it green, there's some additional questions that we got to figure out. But the most important thing that I know is that we want to make sure that we phase it in small groups so that we can contain. Once it's green, we can get a group in. We've got 3 weeks to look at it. And then if it looks like that's still trending where it needs to go, then we can start bringing in the next group. The ultimate goal is to get all of our students back in-person instruction. We know that that's the best way. There's no argument. None of us are saying that we don't want that. But at the end of the day, it's also what's in the best interest for our students and our teachers and the staff members. And, be perfectly frank, there's a whole other group set of people that we've got to look at. And I mean, I know I've seen something here saying, let that be a parent's decision. Well, I'm an uncle, you're a parent. I mean, I know my sister's already told me she's not sending her kids. And that's an important piece, that even though we're talking about this phase in, parents still have the ability to say, I don't want my child in person and I want them to remain virtual. You have that ability and we will still be able to maintain that. And I think that's what I heard last night, right?
That's right. That's right. They still have that option.
Still have that option. And once we find that it's safe and it's an ability, we're giving a plan that's a phase in that will allow parents to know this is the direction that we're going. And those who want to be able to move their children into in-person education, and once we've gotten into a space that we feel it's safe enough and it has the lowest risk, then we'll begin to do that. And I don't think that anyone's saying that we want to keep kids out forever. But there's even some, and I know you probably heard it in there, that we might be dealing with this situation well into next school year, potentially. Not saying that we're going to be in a virtual situation, but this virus, and we're still dealing. We've got probably to the mid part of next year, though I saw something today that said that the Food and Drug Administration just approved a particular treatment. But I mean, we're still talking about the masses. A lot of people being able to have access to that. So I want to make sure I get some more of these questions in here. Will NPS be releasing student impact data on virtual learning? You must be in my colleague Lauren Campson's head because Lauren Campson is probably watching. But we're watching that. And I do believe our next school board meeting, we're supposed to talk about our accountability plan. And I think our colleague, Lauren Campson, who many times we want to say doctor because she's so knowledgeable. She's been a passionate educator and a school administrator who worked tirelessly to get us to get an accountability plan. And as a board, we're going to sit around and we're going to work, hopefully really focused, and making updates to our accountability plan so that we can make adjustments for this virtual environment. But then also to look at, because it's been announced that we're not doing the accreditation based on these test scores and so forth. So we as a district have made a commitment to still measure success and to find out where our students are. I know that our lower grades have done their reading test and some of those other things so that we can figure out where they are. But please know that this board is committed. I know that I'm committed. And I know that it's been said from us that we want to ensure that student accountability is at the forefront there. So I appreciate you for bringing that question. So this one's an interesting. So how do online students interact if they have questions? And I think that they've got some additional time. I think it's built in, right? Even on the Wednesdays, asynchronous Wednesdays, and then they've all got email. They've all got, and I know that many of our teachers have office hours. I think that there are a lot of things that are in place that will help and allow students to answer questions and teachers to respond back to them. Let's see here. We got a lot that's here. This one is a sports one. How does this decision affect Virginia High School athletics for MPS? Winter season sports are scheduled to begin December 7th. I think we're still moving forward with sports. I think that we have, if our last school board meeting, the superintendent showed the video of the different mitigation things for which our athletes are going through. They're getting their temperatures taken. They're socially distanced. They're doing all these additional things in order for them to be prepared. We don't control the Virginia High School League. They kind of give us as to what they want to do, but I do believe our student athletes are still moving forward. But that is very contingent upon, I believe, from my knowledge, what the numbers look like. I mean, if we are in a situation, and honestly, the scientists have said that the next 6 to, I guess, maybe 8 to 12 weeks are going to be the most difficult. So, Dr. Gabriel, why would they say that these next couple of weeks are going to be the worst? I mean, what do we have coming at our headway?
It's really hard because I know that as a healthcare provider, we were waiting for the influx. We were waiting for this wave of patients to come, and it never came. It just never came for us. But in New York City, it completely overwhelmed their system. We were sending nurses and staff and resources up to New York City because of just the mere fact of, the urban setting that they're in. But we have a couple of important things that are coming. We have trick-or-treating. We have Thanksgiving. We have, Christmas and those holidays where individuals are going to want to gather. They're going to have time off. And that's when people let their guard down. And what?
Yep.
And an election.
I said a New Year's Eve. Yeah, an election.
New Year's Eve. But we have an election that's coming up, November the 4th. And so there's increased opportunities for social gathering, which is when you're going to have an increased risk for the virus to spread. And so that's why they say, we really have to be careful about the congregation of individuals. And that's why they're concerned about the virus spreading over these next several weeks.
Definitely. And I'm going to throw Bridget's question back in here, but I also want to make the comment, because I think somebody talked about, about green. And Governor Cuomo in New York, I mean, if you talk about New York, I mean, it's 10 times larger than what we are. But he wanted to ensure that they were in that green zone. And they did. They got there. And then all of a sudden, certain areas started popping back up and they had to reverse. They were going in with in-person. And honestly, that's what we want to do. We want to be able to get to a place where we can be in person, but we also want to be in a place where if we do have an uptick somewhere and something happens, we can control that. We don't want, because we haven't even talked about asymptomatic. Which is a whole nother thing. And that's another concern, for our teachers, but then also we have a lot of older individuals who are taking care of our students. We've got a lot of kids who were grandparents and others. And that concern about having them go to school, being exposed to come back. The NBA did it so well because they were in a controlled environment. They were in a bubble. No one left, no one came in. You were in there for this several amount of weeks, which means that you can control that. We have to deal with buses. We have to deal with people potentially in some of the classrooms. In the higher grades, they've got to move around. They won't have their lunch in their classroom. They've got to actually leave from a classroom to go to the cafeteria. So there are a lot of other things that are being infused, a lot of variables that are being infused into the whole situation, which could really potentially cause some problems. And we're just trying to make sure that if we have to go into the situation, you have it there, that you've got it at the lowest possible. So I know Ms. Baird is asking, will student impact data be used to help make decision-making on opening? I think that when we talk about instruction, that the way that we're delivering that right now, this is why the last sentence was to direct the superintendent to find out other ways of instruction beyond hybrid. And also, I think that we took that in consideration when we talked about who went in first. Mm-hmm. We've already really done that. We said when it's good, that these are our equality and opportunity students. These are the most vulnerable. These are the groups of students who could really fall behind and really be hurt by not having this in person. And so they were the first groups that we put in phase 1. So as soon as we feel that it's safe, those will be the first groups that go back into the classrooms. I don't know if you want to add anything, or if I don't know if I was right on that one, but I think it was.
The other item that we just can't hit home hard enough is something that Dr. Lindsay said when she gave us the presentation. She said our choices have a direct impact on the effect. Our choices have a direct impact and effect on the ability of our children to safely attend school.
Yeah.
The risk for children getting the infection right now is they're on the lower end. The risks of children having a high getting ill from the disease is low. Most kids just get a sniffle, a fever, a little headache, and they're okay. It's for the older adults that are at highest risk. It's for those staff members. It's for their parents. It's for their guardians. Those are the ones that we're trying to protect. When we say we're trying to be very cognizant of our students coming back in, because kids are probably going to be okay. It's just their extended families that we have to think about, and it's our staff, of which it was very clear from Dr. Bertong's presentation that we don't have a drove of teachers waiting in the backstage to take on positions for when teachers have to go out ill or have to quarantine or have to, take on other duties. We just don't have it.
So I think Mr. Thompson was talking about cohorts, house A and B live with the same teacher at the same time. And I think this came up in our discussion. Were they addressing that when they were talking about the scheduling? Because if you had one child that was going, if they're in the same school and they were going at different times, would that potentially open up the exposure? Because we want to talk about contact tracing if we needed to do that. And I think that they're beginning to put that into the scheduling. I think that's what Dr. Pohl mentioned to us.
Right. And to answer her question, yes, it will be the same teacher at the same time. And the 100% virtual students, they will be receiving that same instruction because they're basically cohorting those students into the classes that they're already in. And her concern is very valid. And I heard that brought up by some of our colleagues, and you and I both said that this was the main reason why we were not 100% all in with the hybrid model, because we're concerned about teachers having to go in between students that are face to face with them and the students that are joining in virtually. It's difficult. It's going to be challenging.
Yeah. So I want to address this one. Erin Sweeney has several questions here, and I guess she wanted to talk about my I guess New York City is not Norfolk, just like Norfolk is not Chesapeake and Virginia Beach. You're absolutely right. But if you were to go in, and they would tell you scientifically to look at New York City and their composition, when you start looking at their boroughs and you start looking at their neighborhoods and you start looking at the demographics of the diversity mix within their schoolhouses, they look like Norfolk and they don't look like Virginia Beach or Chesapeake. So I'd stand on what I said. Man, let's see here. Bridget Schultz, thank you. Is this something only the board votes on? Oh, that there's a side conversation going on in there. So there's a recent data show that COVID-19 cases rate at 0.13% among students and 0.24% among staff and schools in the building. And will the board ever consider reopening if the data supports that in-person school is not a high-risk activity? And I will say that I will not say never and never on anything. I think that as we get more information, as more data comes out, it helps to inform myself. I know me personally as a board member as to the votes that I'll make. Back in September, I came out with the Restart Smart. I adopted that from the National Urban League. And for those who don't know, I used to serve as the national president for 4 years and been all around this country, been all 2 of the 50 states. But I know for me, looking at and having the experts and having that information and listening to the science, and also taking into consideration the concerns. I've been listening to tons of parents. And to be perfectly honest, we have just as many voices that are talking about it, put them in school, put them in school, than we have that are saying no, no, no. And it goes back to, because I'm a student of leadership, and I will say that it takes me back to that thing that you're never going to appease everybody. And if you are trying to chase to make everybody happy, you're never going to succeed. And so you've got to really work towards getting the necessary information in front of you to make an informed decision. And so that you, at the end of the day, at night when you go to sleep, that you know you've done everything that you could possibly do. And for me, I know that there's more to do. But I think that we took a critical step yesterday to inform the community and for us to begin to continue to have conversation as a board, and to engage like we're doing here today. One of the things I talked about in that Restart Smart was about community engagement and having forums and opportunities for individuals to be a part of the process. And that's something I'm going to continue to push as a board member, to our superintendent, to ensure that our teachers, more of our parents, other students are at the table as we continue to talk about what these plans look like going forward. And I won't be on my soapbox horse, but that's just kind of where I am. I don't know if you got anything done. So we've got, we're confused. Let's see here. Someone added about the student representatives added value to your conversation last night. Have you considered having a teacher representative as well? Well, are you talking about on the school board?
So, well, we have a student representative on the school board. We do not have a teacher representative on the school board, although Ms. Campson reminds us every day of her years of experience being a classroom teacher, reading specialist, of AP, a principal, etc. But what we do hear from our leaders of our teacher unions, we have 2 within the school division, and teachers have flooded our emails with their suggestions, their concerns, and so we do hear from them every day, and we value their feedback. And as demonstrated by the teacher survey that the administration put out at the request of the board, the teachers overwhelmingly shared that they were not comfortable with coming back to in-person instruction. Yeah. And that's the data. I can't argue with what that data shared.
Definitely. And now, and also in regards to the teacher representation, our teacher of the year, as well as the other teachers of the year, also are part of a superintendent's kind of cabinet, where she listens to them as well as the student cabinet that the superintendent has. So there are other groups, just like we have tons of advisory committees in the school division, that the board has to support us. And when we talk about technology education and career technical education, special education, gifted, they're all there so that we have a voice from the community. And we will actually be taking up a vote next month. I'm serving on policy now, so I know it's coming, to actually finalize the process and the new rules for our advisory committee. So those who are watching, we definitely encourage you to sign up if you want to be able to serve and be a voice of any of those groups, to help us assist us as board members. So it is 7:56. I wanted to keep an hour. I know that everyone is probably really excited to go and watch the last and final presidential debate tonight. Let's see here. All right, so I'm gonna. I mean, it's 7:56. We've had an hour here. I guess, do you have any closing remarks you want to share with individuals?
I'm very appreciative, Mr. Clanton, for you opening up this venue to allow us to have this conversation and to kind of break things down after our 7-hour meeting last night. It's very difficult work, but it's important work, and I'm very humbled to be able to, be in the position to make these types of decisions, which I know don't work for 100% of our groups, but we're trying to make it work for the most. We have had a lot of emails, phone calls, and messages, and I truly appreciate all of them. I have not been able to respond to each and every one just because of the sheer number of messages that we have had, but they are read. They are read and they are taken very seriously. I want to finally encourage everybody to get their flu vaccine. It comes from Dr. Fauci. It is a recommendation that the American Academy of Pediatrics fully endorses. By getting your flu vaccine, you are helping to decrease illness that hopefully will already be down because people are social distancing and washing their hands and doing more things. But we cannot afford to overburden our healthcare system if we start to see outbreaks of the flu, which will put more students and staff out of, the ability to educate because we're dealing with a flu outbreak at the same time of dealing with potential COVID outbreak. So I thank you, Mr. Clanton, for this opportunity, and to everybody that took time out of their schedule today to join us.
All right, definitely. And I concur, definitely. And I will say this. I know that some of you all, if you do your comments, you send it to the school board at NPS K-12. Some of you have figured it out. All of our emails, individual emails, are listed. If you send it to that group email, it doesn't give us your responding email. And so if you send it to the school board one and then put our individual ones there, then we'll capture your email. And I'll tell you, I go through, if you email me, I know that Dr. Gabriel, I modeled after her. She's a mother, doctor, and she replies to emails. And I do the same thing. But if you send a direct email to us, we will respond back to you. That's the only way that we can do this. And I know that Dr. Gabriel and myself both, we didn't get on the school board because we wanted a title or to go around and say whatever else. We're products of the school division. We care about it. We care about our community. We care about the kids. I don't have any kids. I have a niece and a nephew who are still in Norfolk Public Schools, but I've got almost 30,000 that I care about. And I want to make sure that they have an awesome experience just like I did, and that they're prepared for our community. So definitely reach out to us, and we'll continue to do forums like this. I thank you all I have a live show, and Dr. Gabriel's up here. I think I'm starting having you up here like every other month to come hang out with me. We're like the dining room.
Our own podcast. We can just break it down,
Break it down. It's a school board podcast there. But yeah, and I said somebody said that they've sent to us, make sure you put our individual emails. If you send it to the school board one, we don't get your responding email and we can't respond back, but we've read it, definitely. But make sure you put our individual ones in there, and we'll definitely get back to you. But it is 8 o'clock, guys. Remember, the final presidential debate is at 9 o'clock. Don't forget, if you haven't voted, vote early. And if you don't vote early, make sure you show up to the polls, make sure your voices and your vote are heard. Again, thank you for joining us tonight. Dr. Gabriel, thank you for coming out and being here with me. And for everyone else, please have a great evening. And we're going to definitely do the best that we possibly can. Take care, everybody.